Okay, so this exercise is for working the hamstring muscle on the back of the thigh. So in terms of trying to stabilize, let's say, a knee injury such as a torn internal ligament, that normally if this is the thigh and this is the shin bone, right at the knee joint, imagine my fists are the knee joint, there's this hinging that occurs with bending and straightening the knee. There's also a little slippage that can occur if those internal ligaments are compromised, overstretched, or damaged, or gone. So what also prevents that shin from slipping is the hamstring muscles. So this is one of the secondary stabilizers of the knee, and this is an exercise for that. So you're going to need a roller stool, preferably for this one, office chair of some kind. Carpet will be more friction between the wheels, so it'll be more work. If you want to start out with something easier, then go on like a linoleum or a hard, flat floor, like a tile floor. So I'm going to give you a little bit of a backup view. So in this case, let's say my left knee has internal stability issue, and I want to increase the stability. So I'm going to use this left hamstring exercise. I'm going to put my right foot onto the leg of the chair, and I'm just going to pull myself forward with my left leg, rolling forward as best I can, however far I can go in my room. And then I'm just going to use both feet to walk myself back, and then come back forward again. If I'm in a confined space, then I can just push out, keep my heel dug into the ground, and pull forward, and just push back and forth, and just do hamstring pulling, thigh pushing away, hamstring pulling forward, and just work both sides of the knee this way. If that causes pain in the knee, then try a smoother surface to roll on first. Or if you have to, you can assist by dropping the right leg over the left and helping, and eventually going back to one leg, or you can just try to pull both on the ground this way. Those are all variations of the same idea of trying to strengthen the muscles like so. So repetition-wise, I would do that for up to a sense of fatigue ideally. You want to get the muscle a little tired. So right now I actually feel a little heat in my hamstring with just doing that much. So again, it's all relative. But if you don't fatigue the muscle or make it feel a little warm like you do when you exercise, then you're not going to put enough challenge into it to really change. So you don't want to get a cramp, obviously. If you do get a cramp, deal with it and squeeze it, hold it, let it go away, but that means that muscle is very weak and it needs to be strengthened. So through repetition, that cramping phenomenon will decrease, but cramping is a testimony of weakness, ultimately in this case, or a lack of flow or nutrition. And so try to get through that if that is the case, but very unpleasant in some people that experience that. Not often, but it happens. So for this particular scenario, I would say try to do maybe 5 rounds of pulling, or up to 3 to 5 minutes worth of continuous exercise with that leg. Or if you get fatigued first, fine, go ahead and stop. You can go to the other unaffected side and run through a few sets of exercises on that one and see how much time and effort it takes to fatigue that unaffected leg, and that will give you a reference point of how hard to push the other one over time. But think about doing this over a 3-week period or longer. Don't try to do this all in one day. So when you build up your exercise, feel a little bit of fatigue, rest, wait till the next day, make sure nothing's going on as a delayed factor, and if it goes well, then you can start to get a little bit more creative and confident with how much you push the knee. Okay? Good luck with that one. Hope that helps.